So the purpose of my speech tonight is to teach you and inform you on how to recognize the heart attack. So imagine being in your backyard and your neighbor screaming at you from across the way, asking for help, and you're not exactly sure what's going on. As you're approaching throughout the day, you've kind of noticed that he's being back and forth inside the house, and that's kind of unusual for him. Usually he sits back and on the back porch most of the morning, and does his morning routine. So you walk across there, and he starts to describe some signs and symptoms of what may be a heart attack. So as I go through this, I will make some points as to what exactly to look for and what some of the causes and signs and symptoms and how we can help people. So first is how can we make somebody a difference in someone's life? We're going to look at some statistics of a heart attack, the overview of the signs and symptoms, and how you can make a difference in someone's, some instruction on some of your actions. So what is a acute myocardial infarction? First thing we look at is chest pain within itself. Chest pain can be described in many different ways. Most people describe it as mid-sternum on the front side of their chest. Some people may describe it other different ways due to some comorbidities that they may have. So when this starts to happen, cardiac tissue can start to die because of the makeup that it has to itself. Cardiac tissue in Tabor's medical dictionary is described to have its own functionality. It excites itself, it pumps itself without us having to tell it to pump on a pretty regular basis every so many seconds. Some people may describe some shortness of breath. This is that feeling of impending doom, that they don't know exactly what's going on at this particular time. And it also, that shortness of breath can cause some anxiety issues due to the hypoxia or the decreased oxygenation that they're feeling, especially within the heart, but also maybe happening within the lungs. Some diaphoresis, which is sweaty skin. That is because the changes that are occurring within the body itself, and the body's not being able to maintain its homeostasis state or the normal state that it should be maintaining. So now that we've talked about some signs and symptoms, next we want to talk about some of the costs that maybe occurred, not only personally, but to the United States, to everyone in general, and some demographic information. So demographically, most heart attacks occur in the male population, especially around the age of 59, and that's coming from the National Institute Medical Library that's quoted down or cited down in the bottom. Some of the comorbidities may be high blood pressure, smoking, high cholesterol, and also body mass index does play a role in sometimes the effects of a heart attack, and also could occur a heart attack. Back in 2016, it was estimated that $84.9 billion was spent, and $29.8 billion were in direct medical expenditures itself. So that that in itself is a large incurred cost. So it $14.6 billion was lost in productivity from the heart attacks itself, and on average it cost approximately around $10,000 less than the average salary that a person would incur after having a heart attack. So all this together, pretty much tells us that having one of these could cost us and the population a lot of money. All right. Lastly, we're going to help you know what to do in these situations. So how can you assist? First, you need to know the signs and symptoms, that I described in the first point in the first slide. So, if you encourage somebody or you come up with somebody that is having the chest pains and that radiation down the arm, and the shortness of breath. Next, you need to know exactly where you're at, okay? If you don't know exactly where you're at, we have so much technology now that it's going to be pretty quick and easy to find out. Next, you need to, of course, call 911. Luckily, 911 now can track you down by your cell phone if you're calling off of a cell phone due to the technology that has increased immensely over the years. And then you need to understand, what that dispatcher is telling you. Okay, if they give you certain instructions, such as possibly giving aspirin, are you comfortable with doing that and following those instructions? Also, being trained in CPR may be a great asset to you. That way, that if that person doesn't go unconscious, you'll know exactly what to do next. So, next, what hospitals can treat these signs and symptoms? So, those hospitals need to be able to have the capability to place the cardiac stents, to treat those patients in the long term and the short term. So, the facility needs to have pretty much what they call a catheterization lab available at all times if possible, but for sure within the time period in which your encounter, or if you are having the signs and symptoms yourself. Being able to transport that person safely, do you feel comfortable transporting him in a personal car that you have or that he has, or do you need to call 911 and let the ambulance personnel and the medical personnel come and take them? And also possibly knowing where a defibrillator is located. That would be a great help if something was to happen. So, bringing all this information together, we can all make a difference in someone's life, no matter where we are. To summarize the story above, basically the neighbor was able to assess that person that was having these signs and symptoms and made the decision, due to him having several different episodes, made the decision to actually call the ambulance to transport him safely to the hospital. Luckily that the patient, the neighbor had a great outcome, had a cardiac stent placed, and everything was successful, and now he's back home. So luckily the person that walked over there was a past trained EMT, so he did have some training and knew exactly kind of what to do. It was just making those crucial decisions at the end of the day. And that will be it. Thank you.